My dear students, Assalamu alaikum. We are at the end of inflammation. Previously, 3 lectures we visited in our channel. Today, last topic on chronic inflammation. It is difficult to define, but must remember it is an inflammation of prolonged duration and characterized by 3 points which occur simultaneously. Active inflammation, tissue destruction or tissue injury, and healing process. All proceed simultaneously. So, chronic inflammation characterized by active inflammation, tissue destruction, and healing. It may be specific or non-specific. Most common causes, it includes acid fast bacilli, fungal infection, treponema, which are characterized by low toxicity with prolonged duration, and this act through delayed hypersensitivity reaction and granulomatous inflammation occur ultimately. Besides, some potentially toxic agents as silica, atherosclerosis occur due to toxic plasma lipids. Also, rheumatoid arthritis, SLE, so chronic inflammation is characterized by infiltration of mononuclear cell including macrophage from monocyte, which derived from monocyte in circulation, which when it exits the circulation known as macrophage, lymphocytes and plasma cells. So chronic inflammatory cells are macrophage, lymphocyte and plasma cell. Also, tissue destruction, angiogenesis and fibrosis occur here, and all the action is the prima donna of done by macrophage. What macrophage act through? It leaves the circulation and recruit the site of inflammation and name a new form as macrophage when it is modified from monocyte. Then it proliferates, become immobilized, and can be differentiation occur according to the site or tissue as microglia in brain tissue, known as Kupffer cell in liver, alveolar macrophage in lung tissue, or pulmonary parenchyma, and osteoclast in bony tissue. All are macrophage which derive from differentiation of macrophage. How they form? Monocyte from circulation. When these are activated by interferon gamma from activated T cell. Activated T cell, due to inflammation or injury, secrete cytokines, various types of cytokine, among which interferon gamma act on monocyte and turn it a modified cell, which become more larger, more activated, more granules within the cytoplasm, known as macrophage. Then what it will do? tissue injury, local tissue injury, and healing by fibrosis. Again, show the cyclic pattern where activated macrophages are formed or stimulated by the interferon gamma from the activated lymphocyte. Again, macrophage stimulate the lymphocytes and cause more recruitment of lymphocytes, and more recruited cells secrete more interferon gamma, which activate or modify the macrophage to become activated. This activated macrophage, now named what, when activated and form granuloma, it is known as epithelioid cell. Now granuloma. These are focal collection when activated or modified epithelioid or modified macrophages form focal collection. It is known as granuloma. Granuloma formed by various types of organism or non-organism process. Some bacteria like typical and atypical mycobacterium like Mycobacterium tuberculosis, Mycobacterium leprae, Mycobacterium bovis, parasites like schistosomiasis, some fungus, foreign particles as metal, silicon, splinter, suture, and also unknown sarcoidosis, also an important cause of granulomatous inflammation. How a granuloma forms? So this is focal aggregation and formation of a granuloma. What it contains? It contains, we see, macrophage, area of necrosis, also mononuclear cells, and also fibrosis will occur. How it forms? When the organism is only engulfed, not killed or digested. So the causative agent have the capacity to persist intracellularly, and they persist long time. So engulfed microorganism like Mycobacterium tuberculosis within the macrophage, they remain intracellularly for long time and proliferation occur. Their proliferation cause some release of cytokine. So more T cell become activation and recruitment. This recruitment also secretes some chemoattractive factor like interferon gamma, and interferon gamma reverse recruit more macrophage. So one invite another. T cell invite macrophage and macrophage reverse invite T cell, and their accumulation ultimately form a granuloma, where the macrophage become more modified, known as epithelioid cell. Some of the epithelioid cell are characterized by multinucleated giant cell known as epithelioid giant cell, and surrounding area is covered by fibroblastic proliferation. So often you have to draw a picture of granuloma, show various types of cell here, area, amorphous area. For granuloma, for a tubercular granuloma, we remember AGE, amorphous granulomatous. So amorphous area is known as caseation necrosis. While granular, the area of necrosis is characterized by AGE, amorphous, no morphology. G, granular, this area is granular. We show alternate light and dark area without any morphology. So amorphous and granular, and also the color is eosinophilic. It takes as the contents mostly are cytoplasmic. So the caseation necrosis is characterized by amorphous granulomatous eosinophilic material. These are caseation necrosis. And here and there we see some cell with eccentric nuclei. If you locate a cell with eccentric nuclei, abundant cytoplasm, having abundant cytoplasm, this is cytoplasmic outline. It is known as modified macrophage or epithelioid cell. So caseation necrosis with accumulation of modified macrophage or epithelioid cell, and also Langerhans type of giant cell here and there, recruitment of lymphocytes, and peripherally fibroblast also present in low power. So now in a short review, we clearly understand what are the causes of granulomatous reaction, pathogenesis of granuloma formation, and the content or components of a granuloma. How can it be differentiated from other granulomatous reaction? By area of caseation necrosis. Caseation necrosis absent in case of other granuloma, whereas it is only specific for tuberculous reaction. Also, giant cell can differentiate the well-formed multiple caseating granuloma usually present in tuberculosis, whereas ill-defined granuloma without necrosis is specific for sarcoidosis. At last, again review acute and chronic inflammation. Acute inflammation characterized by flush, flare, and wheal. For you, flush, flare, and wheal. There is congestion, there is heat, temperature, where little sign in case of chronic inflammation. Fibrosis is a sign of chronic inflammation. There is no swelling almost. Temperature may not be raised or sometime may be raised. Inflammatory cell, acute inflammatory cell, neutrophil, chronic inflammatory cell, lymphocytes. Next to me, single cell, specific for acute, neutrophil and lymphocyte or mononuclear cell for chronic inflammation. Vascular damage is characteristics of acute inflammation where neovascularization or angiogenesis is specific for chronic inflammation. Exudation mode in case of acute inflammation, which ultimately cause swelling, almost no or less exudation in chronic inflammation. Whereas fibrosis is specific or prominent in case of chronic inflammation, but it is little or no fibrosis in case of acute inflammation. Students, in this 4 review class of neoplasia, we almost discussed the written question, also the viva topic of this chapter. Hope you visit our lecture at your convenient time. So we all should pray for a new morning, COVID-free Bangladesh and COVID-free world. So today no more students. Thank you all. See you again.